Common symptoms of borderline personality disorder, BPD, self-harm and suicidal thoughts. Self-harm and suicidal thoughts are among the most serious and distressing symptoms of borderline personality disorder, BPD. These behaviors are often driven by intense emotional pain, feelings of emptiness, and the inability to cope with overwhelming emotions. Self-harm and suicidal ideation are not attempts to gain attention but rather serve as coping mechanisms for managing intense emotional distress. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore the connection between self-harm and suicidal thoughts in BPD, how these behaviors manifest, and the importance of addressing these symptoms in treatment. What is self-harm in BPD? Self-harm, also known as self-injury or non-suicidal self-injury, in SSI, refers to deliberately causing harm to oneself as a way to manage intense emotions. For individuals with BPD, self-harm often occurs in response to feelings of emotional numbness, anger, anxiety, despair, or overwhelming sadness. These behaviors are a means of expressing emotional pain or gaining a temporary sense of relief from the intensity of their feelings. 1. Common forms of self-harm in BPD. The most common forms of self-harm include cutting, burning, scratching, or hitting oneself. While some individuals may resort to substance abuse or reckless behaviors, for example, reckless driving, substance use, others may engage in physical acts of self-injury as a way of coping. 2. Emotional relief from pain. For many individuals with BPD, self-harm provides temporary emotional relief. It can create a sense of control over emotions or offer a way to release overwhelming feelings. The physical pain associated with self-harm may momentarily distract from emotional pain, or it may provide a sense of aliveness when someone feels emotionally numb or detached. On numbing emotions, the act of self-harm can create a distraction from feelings of emptiness or emotional numbness, offering an intense, immediate sensation that contrasts with the internal emptiness they feel. Immediate relief. For some, the release of pain from self-injury provides a sense of relief from intense emotional states, even though the relief is often short-lived. 3. Regaining control. Many individuals with BPD struggle with feeling out of control due to emotional instability and impulsivity. Self-harming behaviors may offer a way to regain control over their emotional experience, especially when they feel overwhelmed by situations or relationships. The physical act of self-harm can be seen as a response to emotional turmoil that feels unmanageable. 4. Regret and shame. After engaging in self-harm, individuals with BPD may experience guilt and shame. The self-destructive behavior often reinforces negative self-beliefs and feelings of worthlessness. The cycle of self-harm is self-perpetuating, as individuals may engage in more harmful behaviors to deal with the regret and emotional pain caused by the previous instance of self-injury. Suicidal thoughts and behaviors in BPD. Suicidal thoughts and suicidal behaviors are also prevalent in individuals with BPD. These thoughts can range from fleeting feelings of wanting to escape emotional pain to more serious thoughts of death or suicide. While suicidal ideation does not always translate to an actual suicide attempt, it is a sign of the deep emotional distress that people with BPD experience. 1. Impulsivity and suicidal behavior. Suicidal thoughts in BPD are often tied to emotional dysregulation and impulsivity. In response to emotional overwhelm or perceived rejection, individuals with BPD may act impulsively without fully considering the consequences of their actions. The desire to escape emotional pain may lead to self-destructive behaviors such as suicide attempts or self-harm. Emotional reactivity. When individuals with BPD experience overwhelming emotions, such as rage, shame, or hopelessness, these feelings can trigger thoughts of suicide or self-harm as a way to end or escape the pain. Impulsive actions. Suicidal behavior in BPD may be impulsive, meaning it can occur without premeditation or planning, but rather as a reaction to overwhelming emotional pain. 2. Fear of abandonment and suicidal thoughts. Many individuals with BPD experience intense fear of abandonment. When faced with a perceived threat of rejection, such as a partner pulling away emotionally or a conflict in a relationship, they may feel a sense of desperation and hopelessness. Suicidal thoughts can arise as a way to express the intensity of their emotional pain or to manipulate a situation to prevent abandonment. Manipulative suicidal behavior. In some cases, suicidal threats or gestures may be used as a way to gain attention or seek reassurance from others, though this should never be dismissed as mere attention seeking. The underlying emotional distress is very real. Feeling trapped. Individuals may feel trapped in their emotional turmoil, believing that suicide is the only way to end the suffering they are experiencing. 3. Chronic suicidal ideation. For some individuals with BPD, suicidal thoughts may be recurrent or chronic. These thoughts are often tied to feelings of emptiness, hopelessness, or lack of purpose. Individuals may feel disconnected from themselves and others, leading to a profound sense of despair. The thought of ending their life may provide a temporary sense of relief from the emotional pain they feel. Cyclic nature. Suicidal ideation can cycle with the individual's mood and emotional state, often escalating during periods of high emotional distress and receding during moments of emotional stability. Lack of emotional regulation. The inability to manage overwhelming emotions can leave individuals feeling hopeless, leading to repeated thoughts of death as an escape. The impact of self-harm and suicidal thoughts on daily life. Self-harm and suicidal thoughts significantly impact the individual's daily life, as well as their relationships and overall quality of life. These behaviors can lead to 1. Relationship strain. The intense emotional ups and downs associated with self-harm and suicidal ideation can create significant strain in relationships. Partners, family members, and friends may feel helpless, frustrated, or fearful as they witness the person's emotional pain and impulsive actions. The cycle of emotional intensity and self-destructive behavior can lead to misunderstandings and emotional distance, despite the individual's need for support and closeness. 2. Social isolation. People with BPD who engage in self-harm or experience suicidal ideation may withdraw from social situations due to shame, guilt, or a sense of being a burden. They may fear that others won't understand their behavior or that they will be rejected. This isolation can reinforce feelings of loneliness, emptiness, and desperation, further fueling self-destructive thoughts and behaviors. 3. Increased risk of physical harm. The physical consequences of self-harm can be significant, including scarring, infection, or even life-threatening injuries. The repeated cycle of self-injury and impulsive behavior can lead to long-term health risks and physical damage, as well as worsening mental health over time. Treatment and coping strategies for self-harm and suicidal thoughts. Addressing self-harm and suicidal thoughts is a crucial part of treating BPD. Therapy, particularly dialectical behavior therapy, DBT, plays a key role in helping individuals learn to manage emotions in healthier ways and reduce self-destructive behaviors. Other therapeutic strategies include cognitive behavioral therapy, CBT, and mentalization-based therapy, MBT. 1. Dialectical behavior therapy, DBT. DBT is specifically designed for individuals with BPD and focuses on emotion regulation, distress tolerance, mindfulness, and interpersonal effectiveness. DBT teaches individuals how to manage overwhelming emotions without resorting to self-harm or suicidal behavior. Distress tolerance skills are particularly important in preventing impulsive actions during moments of emotional crisis. 2. Cognitive behavioral therapy, CBT. CBT helps individuals with BPD identify and challenge the negative thought patterns that contribute to self-destructive behaviors. It works on addressing the distorted beliefs they have about themselves, others, and their ability to cope with difficult emotions, ultimately reducing the likelihood of suicide attempts or self-harm. 3. Crisis intervention. For individuals struggling with severe suicidal ideation or self-harm, immediate crisis intervention is necessary. This may involve hospitalization or emergency mental health care to ensure the individual's safety and provide immediate support during periods of acute emotional distress. 4. Building coping skills. Therapy can also help individuals with BPD develop healthier coping mechanisms, such as journaling, deep breathing, or engaging in creative activities. These tools help individuals process emotions and manage crises without resorting to self-destructive behaviors. Conclusion. Self-harm and suicidal thoughts are serious symptoms of borderline personality disorder, BPD, that require careful attention and treatment. These behaviors are often driven by emotional dysregulation, intense emotional pain, and a lack of healthy coping mechanisms. Therapy, particularly DBT, plays a critical role in helping individuals with BPD manage their emotions, reduce impulsivity, and build healthier ways to cope with distress. If you or someone you know is struggling with self-harm or suicidal thoughts, it is crucial to seek help immediately. Mental health professionals can provide the support and resources needed to work through these challenges and improve emotional well-being. Stay tuned for more episodes as we continue to explore treatment strategies and coping tools for managing borderline personality disorder.